I'm Charles A. Stewart, Dean Emeritus, University of Georgia. I was Dean of the school from 1964 through 1995, 31 years and 9 months. And it was a wonderful opportunity for me to try to make a difference in our nation and in our state, to educate people to work with the underprivileged and the discriminated against, and those that needed empowerment. It was a wonderful opportunity. Early on in life, I remember asking my parents, why can't black people use restrooms and the courthouse water fountain that's marked, unless it's marked for colored? And they tried to explain to me, but I never could understand it. I had always been someone that was concerned with the downtrodden and the underprivileged and the discriminated against. I just decided that discrimination was wrong and that society was not treating its downtrodden and underprivileged people with enough respect. So that's when I found out that was social work's broader mission. I knew I wanted to be a social worker. Started out knowing I was interested in sociology and psychology, and I got a bachelor's and I got my master's in social psychology, but I didn't realize there was a profession that applied, social work applies social psychology knowledge. But I got my PhD in marriage and family counseling, and then I found out that what I really wanted all along was to work in social work, but I found out late in life. So I turned back around after working in social work for a while as a non-MSW and got my Master of Social Work degree, which turned out to be the one that allowed me to get jobs in mental hospitals. I was director of social work in 2 mental hospitals, one in Georgia and one elsewhere. And then it enabled me to go into teaching when I decided to go into teaching. So I was the first qualified social worker to go to Milledgeville State Hospital. The reason I came there is that they just had a scandal. A reporter from the Atlanta papers had been there as a patient, a legitimate patient, but he took notes and he saw a lot of very upsetting behavior. He saw nurses giving major surgery, self-injectomies, hip nailings. He noticed that many of the physicians that trained were themselves addicts or drug addicts or alcoholics or otherwise somewhat emotionally handicapped. And he wrote an expose. That expose resulted in pouring in of new money from the Atlanta, from the Georgia tax coffers. They hired a psychiatrist, their first board psychiatrist that had ever been director of the hospital. They hired him from Columbia University in New York. And he came in with a big new budget. And he contacted me. I was director of social work at a hospital in Tennessee, and said, if you will come back to your home state in Georgia and be our director of social work, I'll build you a house on the grounds. You'll have free meals in the officer's dining room. You can take class time every day to teach at the local college. And he made it very enticing. And they had social workers before. They were doing social histories on new patients. And it was the biggest hospital in the world back then, 12,500 patients. And we'd do 125 admission intakes a day often. And a social worker had to try to get a social history on each new patient. Educational background, vocational background, marital background. But none of them had training before. And some of them were pretty good. They were just instinctively pretty good social workers without having the knowledge. But using a social work principle of partialization, we decided in the social work department, as I began to add qualified social workers, that we would partialize. We'd take a small sample of patients and work with them verbally to help make a plan for them to get out, and to get well and to get out. I was on the committee appointed by the Board of Regents to study two aspects. They wanted us to find out if Georgia did need a school of social work in the university system, and if so, where it should be. So they appointed a social worker, me, a medical doctor, a lawyer, a seed and feed merchant, and like most of those committees, they were made up of a broad variety of people, most of whom didn't know a lot about social work. And we did a study about the need for social workers in Georgia, and that was easy to establish. Agencies said they needed qualified social workers. So we reported that yes, they needed the university system needed a school of social work. And so the Board of Regents said, then tell us where it should be. So they arranged for the president of Georgia State, University of Georgia, and the Medical College of Georgia to come in and meet with us separately about why they should have the school. And we voted unanimously after hearing from all the presidents that University of Georgia should be the place because it had all the behavioral sciences and had more graduate faculty. Now, if we had been a psychiatrically oriented profession mainly, then it would have gone to Augusta where the medical school was. But by then, social work was moving away from the medical psychiatric model, the old Freudian model, to a more practice-oriented model. So we decided to recommend the University of Georgia. And the president then asked me later who I would recommend be dean. And I recommended the president of the Council on Social Work Education, located then in New York, because he was head of the accrediting body. And if he came in, he would make sure we got accredited the minimum time. So the president wrote him a letter asking if he would come in for an interview to be dean at Georgia. He never got the letter. So the president asked me to be dean, and it surprised me because I'd never thought I would go into full-time teaching. I've taught part-time a lot. And later I met Dr. Ernest Whitty and at the first Council on Social Work Education meeting I went to in Toronto 4 months after I became dean. And I said, Ernie, why didn't you want to take the job at Georgia? He said, I would have loved the job at Georgia, but nobody asked me. I said, the president wrote you a letter. He said, I didn't get it. So he later became dean at the University of Kentucky. He wanted to become a dean, but he didn't know Georgia was interested in him. So that was kind of a male accident that I got the offer.
Several thousand enthusiastic Texans are on hand to give the President and Mrs. Kennedy a warm welcome. Friday, 10 minutes before noon. The motorcade begins the 11-mile ride to the Dallas Trade Mart. In a downtown building, a gunman waits at a 6th-floor window, a high-powered rifle by his side.
That was the day the Board of Regents approved my appointment. I was officially made dean the same day, November 22nd. So I told the president, I said, I'm not an expert on curriculum, and you need an expert on curriculum to get accredited. I said, that's not my field of specialty. He said, we'll make sure you have a budget that you can hire full professors and associate deans who are experts on curriculum. So he did. Gave us a wonderful budget. And the accrediting body, the Council on Social Work Education, wants a faculty that has a practice background. They don't want a bunch of brainiacs, just that came in and got their master's and PhD and went right into teaching. They want somebody to have, so we wanted a diverse faculty, some who worked in mental health, some who worked in child welfare, corrections, substance abuse. So all accredited schools had to have a faculty that was largely made up of people who had a practice background. And I spent 9 months recruiting faculty and graduate students. They were easy to recruit because there was a lot of people interested in getting a master's at University of Georgia. They were in-state practicing social workers. And we admitted 29 students, and we had 13 faculty at that time. And we started our first class in '64, which will be 60 years this year. But I've been there 61 years, but I didn't have a student body or faculty. When I walked in, I didn't have a desk. I walked into an empty office with no desk, no secretary, and that was the first day of the School of Social Work. Within 2 days, I had a desk and a secretary and started hiring faculty. We paid some of them more than I made just to make sure we got the best people available, because the president said I could cut up the budget any way I wanted to hire faculty and give graduate assistantships to students. So they gave us a great budget, and I was able to get Paul Dorschberger out of New York City, Norman Polanski out of Case Western Reserve in Cleveland, and they were prominent names, well-known names because of their research, and a lot of other good faculty. That made up for my deficiency in curriculum. The Accreditation Commission applauded us for having a great curriculum and wonderful faculty. And I put a lot of money into graduate student stipends because I wanted the best graduate students we could get. And for that reason, I have a lot of graduates who are now leaders in the field of social work. At one time, I counted 6 deans and directors that had come to Georgia to get their master's degree. Out of our first 3 or 4 classes, one person became director of corrections for the Department of Mississippi Corrections Department, which included prisons, and another got a PhD and became an instructor elsewhere. So it was graduating students that were leaders in the field. But on a more practical level, it was creating educated students to work in Georgia's child welfare, public assistance, mental health, substance abuse, corrections in Georgia. And that's what Georgia needed so much, was a nucleus of trained people to work in all of these fields. 99% of all the child welfare workers are still not trained social workers because the job is hazardous in terms of stress, doesn't pay well, and it's hard to get qualified social workers to go into that field. And I was real proud of another accomplishment. 3 years after we started, the federal government announced a grant program to create a research university school of social work in each region of the country: Southeast, Northeast, Midwest, Southwest, and Pacific. And it was, I've forgotten the amount of money, it was close to $1 million they were going to give to the school that won out. Well, we competed with older schools. There's never been a school of social work in Georgia, in Alabama, and Mississippi, and South Carolina, and Kentucky, but there'd been one at Tennessee, Florida State, Louisiana, Tulane University, and Virginia Commonwealth University, and North Carolina, Chapel Hill. But we competed with all the older schools to get that grant. And they announced the grant in November, and we had to submit it in January. So we worked, a group of us on the faculty worked day and night, including Christmas Day, to get together a proposal that would give us that grant. And we were so proud of it because it singled us out as the strongest research university, despite the fact that we were so young, the strongest research university school of social work in the whole Southeast. Getting accredited first, it was a big risk because the students gambled that we would be accredited. If we hadn't become accredited, their degree wouldn't be worth anything. So that was the big mission. And to do that, we had to prove the University of Georgia had never hired a black faculty member then. So we had to prove that we were going to be different from the rest of the university. And I hired a black retired faculty member from Atlanta University School of Social Work. And we arranged for students to meet. She'd come to teach with us. She wanted to stay living in Atlanta, so she'd ride the bus every morning, and some students volunteered to go to the bus station and bring her to the classroom, which is just a block, because we were then in Candler Hall, which is the North Campus, not far from the bus station. And we had to prove that. We had to prove we had a good curriculum. I had to prove that our graduate students had good grades and graduate record exam scores. So we did well on all that. That was the first big challenge. And that was probably the only main challenge to make sure we were accredited. We started in Waddell Hall. We were there for 2 years, and we outgrew that. That's right across from Candler. And then they went to Candler Hall, which had been a dormitory, and we later converted another dormitory, Tucker Hall, over in South Campus, to as we'd outgrow one building, they'd give us another building. And they'd usually, social work never gets a new building, because new buildings are usually devoted to the sciences with laboratories and technology and all that. So social work always gets the buildings that have been at one time other kinds of buildings. I wanted to make sure that we got a lot of out-of-state students. There was a big demand in-state. So every time we'd get an application from out-of-state, I would call the applicant and find out their financial needs and make sure that if they were really well qualified with high grades in GRE and other achievements such as who's who in American colleges and universities, or having been editor of their college paper, or having done something else to exceed, then I would fund them immediately to make sure they come to us, because they were usually people that had applied to Florida State or Tennessee or Tulane University, somewhere like that. And I wanted to make sure we got a lot of good out-of-state students. It was important that they not all be in Georgia, and that there be a diverse group of. We had black students from the beginning, and the university had just integrated. Otherwise, we could have never got accredited. The university accrediting body would never never give accreditation to a school that was discriminating in any way. They had to make an 800 on the GRE to get into the graduate school then, verbal and quantitative added together out of 1,600. So it was a challenge to go through the black colleges and recruit enough students who would qualify with the GRE, but I did. And I would go to careers days at predominantly black schools all over the South, Alabama, Florida, Tennessee, South Carolina, Georgia. I'd go to careers days and look for the students that would qualify by passing the GRE. But the graduate school would not let people in who had a low GRE. So it was important to find enough minority students who qualified to prove that we were not discriminating. Because it was all right to discriminate on the basis of grades and GRE scores, but it was not all right to discriminate on the basis of religion or race or sex. So it was important that we that we proved our diversity and that we got accredited. Well, the civil rights movement affected me in many ways. Before I became dean, I was a social activist in a quiet kind of way. While I was at Milledgeville State Hospital, and my other hospital in Tennessee, they were absolutely segregated. They didn't have any black professional staff members. They had separate buildings for black patients. But I quietly went about trying to change things, but I didn't. It didn't work, but it worked partially. For instance, even though the superintendent of the hospital was a Columbia psychiatrist, he didn't want to buck the segregated system here, but he wanted me to get graduate students to come there for internships. So I invited Atlanta University's faculty members to come and visit us to approve us for placement of graduate students, all of whom would have been black. and I took them to the officer's dining room. Now that hospital, like all old hospitals, was highly caste-oriented. The officer's dining room was only for people with master's degrees and above. And our case aides that we were training to go get master's degrees couldn't eat there. But an MSW and a PhD and medical doctors could eat there. Well, I brought those black faculty members to the officer's dining room, and that shocked everybody. And even the superintendent said, "You didn't clear with me that you were going to create such a havoc here with bringing black people to our officer's dining room." I said, "Well, you said you wanted graduate students, and that was the only way to get them." So he forgave me, but I got calls threatening my life. So it was always a challenge to work in the segregated South. And then we had the March on Washington while I was still at Milledgeville, but I was president of this Middle Georgia chapter of the National Association of Social Workers then, and we sent our delegations to Washington to participate in that gathering, and the one person that we were going to pay their way, and one woman that was director of Family Counseling Center, Macon, we offered her a chance to go. She said, "No, I can't go. My board would fire me." She said, "My board doesn't want to see any social activists working for controversial causes." So we got people to go that would otherwise not be in jeopardy. And when Selma, Alabama occurred, we already had a school of social work going on. I would have calls from other people in the nation, from deans from other schools, saying, "What can we do to help you down there in Georgia to with all the strife that's going on?" And I would tell them, "I don't know how you could help us. We just got to live through it." And we did. Our associate dean one time was the chairman of the University of Georgia Women's Movement. Forgotten what it was called. Her name was Myrtle Rule, and I hired her out of Michigan State University in East Lansing to come teach at Georgia. And she became our associate dean, and she was big into studying whether or not women made equal salaries, and they didn't. That was one big problem. The average male full professor made $5,000 a year more than the average female. The same with associate professors, assistant professors. She sometimes felt that we may have on our own faculty a difference in salary and other factors related to sex, but it was not so much so that that she found it was flagrant. So she became very active in the university's women's movement, so much so that the president hired her away from us to make her the first director of equal opportunity, and she was our first director of that. One is the divide between micro and macro. The profession is so all-inclusive that it includes a lot of people who wanted just to work with individuals on their problems, clinical social work. And that was my first interest. I wanted to be a marriage counselor. I wanted to work with emotionally disturbed people on a one-to-one basis. But I found out when doing so that I really wasn't emotionally cut out to be a clinician. I did not have the patience to help them to enable them to come to their own conclusions. So I got into more into macro. So that's how the profession will continue to bring in people who have micro and macro and give them opportunities to be educated. Because there are a lot of students now who only want to go into macro, community organization and administration and development and stuff like that. I retired from dean. I didn't go back to teaching. And at one time I thought I would have time to volunteer at a local hospital to help, but I found that I enjoy being here so much that I decided I'd not do that. So I don't do a lot. I make sure I give money to United Way and to other progressive organizations, and I try to talk my right-wing friends out of being foolish. The antique store is very satisfying. A woman will bring in 3 guns that her husband left when he died, and I have books of reference on Civil War guns and other guns, and I look up the maker, the rarity, and the value. Another will bring in a Dahlonega gold coin, and I've got a coin book that tells you the rarity, because they made $1, $2.50, $5, and $10 coins at Dahlonega, made out of Dahlonega gold. And so every day I have to learn something. The same with my wife. She buys vintage jewelry, and she learns all the time by having to look up. She can date any jewelry. Some of it's 200 years old. So I think it's the learning every day and enjoying meeting people. Thank you for giving me this opportunity. I left a lot of historical material at School of Social Work, pictures of the first class, pictures of first faculty, and a lot of things that I learned later through the changes of administration. Some were lost or misplaced.
Okay.
So I'm glad this could be made a part of the history of the school. And thank you for doing it.